Good morning, everyone. Hope you're all having a great morning this morning. We will get started here in about another minute or so, right at the top of the hour. Well, good morning, everybody. Thank you for taking time out of your busy day to join us this morning. My name is Matthew Klamer. I am a National Sales and Marketing Director here at Medicare Advantage Specialist. I'd also like to let you know that Medicare Advantage Specialist is a nationally recognized award-winning field marketing organization and a leader in the insurance brokerage industry. And our office is located in beautiful Hoover, Alabama, just outside of Birmingham. We're excited to share with you that Medicare Advantage Specialist has become a partner of Integrity Marketing Group in October of 2019. We've had a long-standing relationship with Integrity Marketing Group over the years, so it was a natural alignment for us to become a platform partner. Through this, Medicare Advantage Specialists will bring more products, tools, and more resources to our broker distribution. We are truly honored to be working alongside other partners in our industry. Integrity isn't just on the cutting edge of insurance technology, it is leading the way. Developed by world-class experts, our proprietary tools, resources, and exclusive services help customize the insurance experience so consumers can find the right coverage and be prepared for the good days ahead. Here at MAS, we're proud of the superior service, support, training, and training we provide to the agents across the country who work here with us. We take great pride in our relationships with our agents and our carrier partners. Our staff provides marketing strategies and assistance, creating numerous opportunities for our agents through the lead programs, our Turning 65 platform, our agency builder program, the Fast Start bonus, and other incentive programs. MAS marketing managers and directors are eager to work with our producers to help you grow your business. We can provide a market analysis of products available in your area to assist you in developing a strategic market plan for your business. We're always up to date on the latest products, carriers, lead programs, and services as they become available in the market. Of course, we're always available to provide both back office and field support, making it easy for you to concentrate on sales growth. Our goal at MAS is literally to help you grow your business. Our specialty is the senior market, and our carrier portfolio is supported by Medicare supplements, prescription drug plans, Medicare Advantage products, final expense, whole life, term life, universal life, and annuities, hospital indemnity plans, critical illness and cancer plans, as well as dental, vision, and hearing products. We offer an exclusive lead program for our agents. Any agent that is direct to Medicare Advantage specialist with 3 or more active carriers will get a discount on their first lead order. And then our co-op program is available for consistently producing agents. As you can see, you can get a 25% discount on a mailing after 7 issued apps in a month, a 50% discount on a mailing after 12 issued apps in a month, or a 100% discount on a mailing after 20 apps are issued in a month. We do have lead co-op programs available for our agencies as well that have downline hierarchy, so just call and ask about those cost-sharing opportunities. So check out the new Medicare Center. It is a one-stop shop for everything you need to successfully navigate the sales and enrollment process. You can now experience Medicare Center with the full power of CSG's resources. It offers e-apps, data analysis, quoting tools, competitive analysis heat maps, and an exclusive website plugin to capture free Medicare leads for yourself. This tool will put you on the cutting edge of technology. It offers you the ability to run quotes for Medicare supplements, run quotes for Medicare Advantage, compare products side by side, download applications and outlines of coverage for your desired plans. It allows you to email applications and outlines of coverage directly to your clients. And agents who wish to use the tool just need to register for a username and password for our website and must be contracted with Medicare Advantage specialists for select Medicare products. We also offer a T65 Locator tool. The T65 Locator makes it easy to find local Medicare prospects. It's quick to use, and pulling up the locations on the map is a breeze. The best part, it's free for agents who do business with Medicare Advantage specialists. We all know that growing your business is only going to happen if you develop a winning strategy. Consistently putting in the work and utilize smart tools and platforms that make it easier for you to deliver your expertise to the right clients. That's why we developed a Turning 65 workshop platform. We assist our agents in identifying target markets for the Turning 65 population. We curated a process that is so simple for agents to use that we now have so many agents hosting weekly and monthly meetings, creating a tremendous stream of lead generation. Talk with one of our marketing directors today to find out more about the Turning 65 workshop platform. So prospecting can definitely be a challenge, but we are helping you, arming you with the tools necessary to help you be successful. We understand that our long-term relationship will define itself based on your success as an agent or as a carrier. Medicare Advantage Specialist is committed to exceeding our clients' expectations in every interaction and helping you achieve that same level of service with your customers. Agent support is our primary goal. We provide every tool we can identify to assist you in your efforts to identify, inform, close, and follow your sales process. In practical terms, our marketing team works arm in arm with you to deliver print media, internet, direct mail, and other marketing tools, keeping your pipeline moving. We have one of the most experienced support teams in our industry. When you work with us, you don't need to buy T65 lists anymore. Plus, you get access to the Medicare Center, free marketing customization, our quoting tools, and so much more. And with that being said, now let's get to today's webinar subject. With us today, we have Eric Carney, our Regional Sales Director for Humana. Eric has a long relationship with MAS, and we are proud to have him here with us today. Eric is going to talk about health plans, very near and dear to us, and how we can offer additional support to our veterans. He is passionate and very knowledgeable. So with that said, Eric, I'm going to make you the presenter, and you can take it away.
Yes, sir. Sounds good. So there we go. And I'll hide this view here real quick. And I really appreciate everybody coming on here. I'm going to hide that control panel, move it over to the side here so we can see full screen. But yeah, I really do appreciate everybody. This is definitely near and dear to my heart, especially even recently. So it always has been ever since I can remember, just a whole family and full of veterans. And my son is now active duty. So he's up at Fort Campbell and doing a great job. Already earned the company coin and just grinding. So I'm really proud of him. Welcome to this, and I'm going to be extremely monotone and bore you to death. No, I'm just kidding. We are going to get this thing rolling and have a little bit of fun with it. Please put some questions in the chat. I'm going to try and hide this thing, move it around so you can see the whole screen here. But feel free to put the questions in the chat. We will definitely get to them. And just so you know, what we're going to do is after we cover like VA healthcare, I'm going to go look at the chat, answer any questions in there about VA healthcare. And then the second portion we're going to cover is going to be Tricare for Life. I'm going to pause, answer chat questions there, and then we're going to move on to Champ VA, and then answer those questions, and then we'll go through some follow-up, information. So just so you know, hold your Tricare questions. We're going to get to it. Everybody gets all excited, and everybody asks me to move Tricare to the front, but it's important to understand and have a foundation of understanding of VA healthcare, how that works, before we get into Tricare and Champ VA. So that's why we do it that way. Here's some online resources. These are great areas that you can get information. We find that a lot of agents do not look into Ignite as much as they should. There's so much information in there. Disaster SCPs, like information on veteran health care, like you could find all kinds of stuff in there. So I encourage you to go to ignitewithhumana.com, or you can actually get there from your Vantage page. So when you go into your Vantage page, Humana, basically your workbench, and you look in the left-hand column, you'll see Ignite, and there's a link to it. So definitely do that. And of course, we have our Veterans Landing page and the Veterans Facebook page that are very helpful. I am Eric Carney, Broker Relationship Manager out of Alabama, but what I do is I do a lot of these veteran healthcare webinars for pretty much the whole country, it seems now. We've been doing them for a lot of groups regionally as well as nationally. So we do have a national team that normally does this, but I do get asked quite frequently to do these. I'm really proud to do that. I know this subject very well, and give you the real life version of it too, and what you're going to face in the field, because I faced it in the field myself. I'm not talking to you from a training perspective that has never been in the field. I'm talking to you from an agent perspective and somebody who has dealt with veterans in the field and a lot of experience with that. So April Wall, if you're in Alabama or part of Florida, she is my broker relationship executive. She is my right-hand person, does an amazing job on the phone, answering questions, helping you with marketing and so on. You can reach our veterans channel at humana.com. You can reach that team there as an email if you have additional questions, but certainly there's my email, ecarney2@humana.com. You can email me or text me at 615-430-7685. The reason why I say text me, I live in Gulf Shores, Alabama. During tourist season, a lot of phone calls don't go through to me. It's really kind of odd. So if you text me, I'll get that text and then return your call when I get into a better service area. Again, it's tourist season, so they drive up the cell tower traffic. Anyway, so this is some of our broker relationship team. You've got Louisiana, Mississippi, Tennessee. All these are broker relationship managers on the top side, and then these on the bottom of your BRE. So this is basically your Southeast, a portion of your Southeast support. And normally, though, us as a team, we work together to provide a lot of these webinars that end up going nationwide. We do have these broker relationship managers, broker relationship executives all through the country to help you. You also have access to your market managers, your Humana market managers locally, and they can help you. So we have multiple layers of support. The greatest layer of support for veterans is the veteran channel. So we've had an vet initiative as long as I've been with Humana, and I've been here 10 years. So we've really taken veterans seriously for a long period of time and created a division specifically for them. And so in the Northwest, you got Darren Davis. He's got a very large territory here. Northeast, you have Aaron McCoy. South and West, that's all this dark blue. That would be Scott Mathis is in charge of that. And then we have Dee Hughes taking care of our Southeast. Dee is a Gold Star mom. Everyone else are veterans in that veteran channel, so it's a really awesome, unique team. We also have community executives. So what the community executives do is they actually help agents in the field. So with organizing community events. So we've been doing a lot of things with Friends of Army Aviation, Rolling Thunder, a lot of grassroots community events that those folks are at, we are there with them and we help coordinate, or those guys there and gals help coordinate that effort with you, the agent. So if you got something you want to do, a pinning event, community event that's coming up for veterans, reach out to us and or one of the veteran team members, and we will support you in that effort. So we always have a quote in here. I really love quotes too, and as I get older, I think they become more and more impactful in my life. And I think this is a pretty impactful statement here. As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. At the end of the day, the only thing you have is your name and the words that you speak, but living by those words. And so it's important that we not only thank a veteran for their service, but we do something about it. So we're going to talk about that a little bit later. So these are some of our national sponsorships. These are representative here of some of the things that we support. Just a small portion, really, but we are official national sponsorship members for each of these organizations. Entrepreneurship boot camp for veterans with disabilities. That's a really cool program. So what they do is they put veterans through online classes to teach them how to, build a business of their own, basically. And so then they build out a business plan, all those type of things, and then they go to the college and present that kind of like a Shark Tank deal for investors. So it's a really cool program. Humana was one of their first major corporate sponsors back in 2011. We are a national sponsor for AMVETS. We're a national sponsor for BFW. Everybody asks me why Legion is not on there. We support, our goal with a national sponsorship is to make sure that the post levels get support if we're supporting from a national level. And so we love to support those local posts. And so the Legion we support at the local level. So if you have a Legion that is near you that you want to support, just because they're on this page does not mean we're not going to support them. Actually, we love supporting them. The Legion does so much with us, and we're really happy to support them in any way we can. So Rolling Thunder, that's one of my faves. If you love motorcycles and you love veterans, that is an unbelievable group. They bring awareness to MIA POW that are still out there. They do missing man ceremonies that'll bring you to your knees in tears. I'm telling you, it's impactful, and they do a lot of community events. Love those folks. Vietnam War Commemorations, that is a DOD-sponsored event where they officially welcome home Vietnam War veterans appropriately and pin them. It's a big deal. It's a big event. So if you want to organize one of those in your local market, you can reach out to one of us and we will help you do that. It is painstaking process. The DOD is involved. Certifications are involved. You need to get a list of veterans that will RSVP and be there for this pinning event. So it does take a couple of months to put those together, but it's worth every second. It's really impactful. Disabled American Veterans, another phenomenal group. We just paired with them on a national sponsorship level last year. And the DAV, and here's our national sponsors, as you can see, that we're the exclusive Medicare Advantage sponsor, and that would be those three. DAV they have some of the most amazing veteran service officers I've ever worked with. And we're going to talk more about veteran service officers and why those are so important. But the DAV has really stepped up to the plate and done an amazing job there. So I'm going to discuss that a little bit later. What we'll talk about today, why we asked, are you a veteran? I touched on that. We're going to talk about VA healthcare and VA healthcare with Medicare Advantage and capturing veteran status in this first section. After this first section, again, we're going to take a pause and answer questions for you about VA healthcare and Medicare Advantage as it relates to VA healthcare. And then after we answer those questions, we'll go on to Tricare for Life and CHAMP. So please hold those questions until we get to those sections. So why do we ask, are you a veteran? The first thing that comes to my mind is, hey, you want to thank somebody. That's like immediate. You see somebody with a veteran hat on, you want to thank that person. But we are in a very awesome and unique place in our lives and what we do in our professions. We have the ability to not only speak the words, remember that quote, but actually walk the walk and help these folks. So it's very important that we understand VA healthcare, and you've taken a huge step by being in this webinar, and it's very important. And so you're going to understand VA healthcare after you get through this, and if you have additional questions, you can contact me afterwards. But you've taken a huge step, because when you sit across the table from somebody and you ask them, "Are you a veteran?" most agents don't even ask that because they're afraid they're going to say yes. I'm going to be completely honest with you. I was one of those people. I didn't understand it either. We all have to start somewhere, and it's all important to know. Just like when you sit across the table and find out if they're low income or have Medicare, Medicaid, you have to know that information to properly work up a program for them that's going to fit their needs the most, right? Are they retired? You ask all these questions. Do you have any retiree benefits? And, what kind of plans do you have now? Those type of things. When you ask those questions and do a needs analysis, are you a veteran needs to be at the top of that list. And so if they answer yes, you have to grab more information from them, right? So are you, you could ask different things, to get to know them. What branch did you serve in? Maybe you have somebody in your family that is in that branch, and you can talk to them a little bit about that. What did you do in the service? Most people think that everybody's just a gunslinger, and that is not at all what that picture looks like. There's mechanics, there's pilots, there's all kinds of intel people. There's so many jobs, cooks and maintenance folks and everything. So get to know what they did in the service, and you might be able to relate to what they've done in the service in some way. Where were they stationed? It's really awesome to ask that question because, if they're long timers, every few years, they get moved around, so they get to see all, basically a lot of the world. It's pretty amazing what they get to see. So that's a cool question. And then, are you a member of the VFW Auxiliary, AMVETS, DAV? Are you part of the VA? And ask that question. Do you have Tricare for life benefits? If it's a spouse of a veteran, do you have CHAMP VA? Do any of those sound familiar? Ask those questions because it's important to write that down so you know what you're dealing with whenever you're trying to build a program for that person. Because everybody's different. You may have a veteran in front of you and a veteran spouse, right? So the veteran may just have VA healthcare and the spouse may have CHAMP, and you may have to deal with them completely different. So pay attention to what they say. Are you a veteran? I always do this I love doing this in class in person because this is really cool to ask this question in person when you have a room full of agents, because, you may have, depending on the location, you may have half the room or more raise their hand where they're retired veterans or active duty and they're doing insurance on the side or whatever. And then you say, hey, do you have any spouses or family members that are veterans? And then pretty much 99% of the time, everybody in the room raises their hand. And that, when you do that test, or when I do that test, is very representative to what we see in the field when we see across the table. So first of all, I want to thank anybody that's out there right now that's a veteran or veteran spouse. Thank you for serving this country. Thank you for family members that serve this country. So I wanted to put that out there as well. That's very important to us, and we really appreciate that and appreciate our freedoms because of it. So a country that creates veterans should be prepared to care for them. That should go without saying. But just like I was talking about the last slide, think about this representative-wise. Across the country, we've got 9 million veterans that are 65 and up. That represents 1 in 5 people on a national average that you sit across the table from that is a Medicare beneficiary is a veteran. If you add in the spouses, that is 14 million. And now you're at 1 in 3 on a national average. So if you live somewhere typically near the coast or near a base somewhere or near a VA facility, you're going to notice that you may sit across the table almost 1 for 1 in some areas with a veteran. So it's extremely valuable to know your market and where you are and how many veterans are in your market. And ask that question and just realize how many folks sitting in front of you are likely a veteran or veteran spouse. So you don't want to overlook those, those folks. You want to understand their healthcare benefits, and we're going to talk to you about that today. So what is the VA? So the VA is, and these are the three things we're going to cover. Again, we're going to cover Tricare in detail later, as well as Champ VA. Right now, we're going to focus on VA, but this is just a general overview of all three, just to kind of give you a little nugget there. The VA is healthcare for veterans, reservists, and National Guards from all branches that meet eligibility and qualification requirements. And once they qualify, they receive treatments at a VA healthcare facility. It's a benefit. It is not insurance, right? So we're going to talk about why that's an important statement. It's a benefit. It is not insurance. So just realize that. It's the most common type of healthcare for veterans that veterans utilize, and it's the largest integrated health system in the USA. Think tight HMO, very tight HMO when you think of the VA, very controlled, and it's very large, but at the same time, folks can live a long distance from VA hospitals and VA docs and those type of things. So we're going to talk more about that. Tricare for Life, healthcare coverage for retired military and spouses who have Parts A and B. If they don't have Parts A and B, they don't have a primary care or primary payer. If there's no primary payer, Tricare for Life will not work because it is a secondary coverage, similar to a SUP-F with drug coverage. So think of it that way. Champ VA, same kind of thing. It's just for a different group of folks. Healthcare for a spouse or dependent of a veteran who meets certain criteria connected to disability criteria, service-connected disability criteria. Again, has to have a primary payer, so it has to have Parts A and B for Champ VA for retirees. It has to have Part A and B as a primary payer, and then Champ VA pays as a secondary, kind of like a SUP-F with drug coverage. So same kind of thing there. So we're going to talk about eligibility and qualification for VA healthcare. Service makes somebody eligible. So if they have served honorably, they got their DD-214, that makes them eligible. But the veteran must also meet other criteria to qualify. So if they were never injured in service, they would have to financially qualify to get into the VA. And that's just a quick example there. If they were ever injured in the service, they would need to contact a VSO, and we're going to talk about that a little bit later. And they would help them with their qualification, tracking down the injury paperwork and all that kind of stuff to get them an automatic qualifier without financial to qualify for that VA healthcare. So not all veterans are eligible or qualify for VA healthcare. So if a veteran was dishonorably discharged, they're not going to qualify in any way for VA healthcare. It's just not going to happen. So they would have to be eligible through service, have that DD-214, and then qualify afterwards to get that VA healthcare. So not all of them. They may not have ever gotten injured in the military ever, and they make too much money and they can't get in. It's just. But that doesn't mean they shouldn't apply when their financial situation changes the next year. So I have a little story about that as well. So how do veterans apply? So y'all do a wonderful job of going out and helping folks sign up for Medicaid benefits, LIS benefit, like all these things y'all help people apply for. Why would you not help them apply for VA benefits, right? So there's a couple ways you can do it to aid them. The number one priority for you, hopefully you will have, or the member will have internet service of some type, or you would have a hotspot or something available to help them create an account on va.gov. So that is really amazing if you do that, because you can digitally create a profile for that veteran or help them do that with a login and all those cool things. And then if they have ever had an injury in the while they served, they can have a VSO become medical POA, and they can upload the medical documents through that portal for that veteran. So that's a really cool way to do it. You can also upload any financials that may be required in there. So any paperwork can be uploaded through that portal really super easily. So that is the ideal way to do it. You can also download the 1010EZ form and then submit that online or in person. Or you can do like the old school knockout questions. So the old school knockout questions, think life insurance, right? So remember how I don't know if you all remember, you call and then, they'd answer the knockout questions. If they answered something that wasn't, feasible, they would say, okay, you don't qualify, or you need to supply additional information, or you have a provisional yes. And then what do you have to do after that provisional yes? Provide additional information. And so they'll have to either go down to the VA facility or create that profile on va.gov and upload the information. So you can do the knockout call questions. It takes about 15, 20 minutes. That gets the process started as a last-ditch resort. But the best possible way to do it is va.gov and help them create that profile. So we're going to talk with specifics related to the VA. So we get a lot of questions about this. From veterans. I know I got it when I was an agent that was actually in the field selling, and it was, hey, why should I take my Part B? Maybe somebody at the VA told them, not to pay for it. Hey, why you have VA health coverage? Why would you pay for your Part B? I hear that all the time. But you know what? In the handbook that I'm going to send your leadership here at MAS, you're going to have the handbook, and in that handbook states that the VA is not health insurance. So if they don't take their Part B, then they don't have credible health coverage. And so they're going to have to pay a penalty if they ever pick it up in the future. We're also going to talk about how it is extremely dangerous if they end up getting into an emergency situation and don't have their Part B, because a reimbursement or payment for a civilian hospital or ambulances is not a guarantee to have it paid. So could you imagine getting into an emergency situation where you had a civilian situation, you don't have Part B, you have and then you just have A? Imagine how expensive that would be, right? So it is important for them to have Part B. It is in the handbook, and they recommend taking Part B. If somebody verbally told them at the VA not to take Part B, that's on that person individually or that office and has nothing to do with the official position of the VA. So you'll be able to show them that information right in the VA handbook that I'm going to send to you in a digital format. Now, what is credible coverage from the VA is drug coverage. So if they happen to delay their Part D as in Delta, that's not a problem. That will be credible. If they have access to the VA, then they would have credible drug coverage through the VA. So that is credible. But the health, again, the health side, Part B side, it is not credible medical or health coverage. All right. Oops. Oh, I guess it's just showing me a little cards there. Okay, so this is another confusion. So you're seeing we're going through a couple of confusion slides here for the way members look at it. Okay, so a lot of veterans, what they think is they're like, I'm just really ticked off. I got a priority group 6 or 7, and they think that because that word is priority, they think that is going to be in relation to the order in which they are seen at the VA, and that is simply not true. It has nothing to do with that. All it is if you kind of blank out the priority side and you just focus on groups, group 1 through 8, basically these veterans are put into groups based on a lot of different factors. Where they served, if they had service-connected disabilities, all kinds of different things, right? And it determines how they, what kind of copays they pay, for what, all those different things. I mean, there's a ton of different things that they could be in different groups for, okay? It has nothing to do with the order in which they're seen. I am going to send you a summary that shows you a basic overview of the priority groups. So if somebody has a question for you, if a prospect has a question for you that's a veteran about priority groups, you can reiterate to them that it does not correlate to the order in which they're seen at the VA. The VA will not worry about that. But what it does correlate to is, like I said, possibly copays and where they served, injuries they've had, those type of things. So VA healthcare, it's affordable, but it certainly is not free. Nothing's free, right? Veteran rated, 50% disabled or higher, do not pay copays. But that came at a great price. That wasn't free either, was it? So priority group 1, if you come across somebody who says, I go to the VA and I pay nothing for any of my care and none of my prescriptions, and they're unsure of which priority group they're in, they are likely in P1. So just so you know, if they're not paying anything at the VA, they're likely 50% disabled or higher. That is a great indicator to let you kind of get an idea for that. It's not guaranteed that they're P1, but it's a good possibility. So generally for priority groups 7 through 8, you would have a copay for primary care, $15, and $50 to go to a specialist at the VA. So again, those are assigned PCPs, assigned specialists. And so a lot of times, depending on the market, it can be difficult to get second opinions. It can be difficult to change PCPs or change specialists, depending on the market you're in. So that's something to keep in mind as well. And then additionally to that, I will say that let's say somebody has a leg injury in the military. They may have to pay a copay for other doctors that they see, but everything related to the leg, as long as the paperwork was done correctly, meaning medical care and prescriptions, they'll likely have zero copay for that part of their body that was service connected, but have to pay copays for other things. So just realize these copays can vary based on injury or condition. Now we're going to give an example of inpatient care. So we talked about, your primary cares and your specialists, those type of things, and gave you a general idea of copays there. Now we're going to give you a general idea of inpatient care. So if I'm a P7 or P8, these are the two examples we're going to use. The first 90 days of the year, it's only $296.80 for those folks, and they pay $2 for each day that they're in there on top of that $296.80. So that is a P7. Now your inpatient, a P8, first 90 days of the year is a little pricier, $14.84 plus $10 for each day. A lot of folks that are in P8 are a lot of veterans have stated that they look at P8 as almost like a staging. So a lot of those folks are still dealing with paperwork and those type of things, turning things in to be put into or assigned to a different priority group that would reduce those costs. So it's typically in process for a variety of things, but they have access to the VA. So what about prescriptions? This is a big one that always comes up. Obviously, if you're thinking, if you're going through a needs analysis with somebody and you're diving into all this stuff and they say they have VA healthcare and they're talking copays with the doctors, maybe a lot of them they like, maybe some of them they don't, or maybe they're happy with everything at the VA and the prescription side is the only thing that's hurting them a bit. So if they come out with their basket full of meds, that's usually a good indicator of why they might be a little upset about the cost of the meds. The meds are very controlled and affordable, but if you have a basket full of 35 meds, it can get pricey if you have to pay for all those, right? So just to give you an idea, 90-day supply or less for a tier 1 preferred generic is $15. That's 90-day supply. The reason why it says or less is, remember I told you, if you have an injury or condition related to your service, that med would be less, right? It would be a less of a cost because it would be zero because it's related to an injury or condition. It could also be less based on their income, so it could have a reduced cost for that. So there's multiple reasons why it might be less than 15, but in general, a 90-day supply of a tier 1 is 15. $24 for a tier 2, $33 for a brand name. That's pretty darn good right there, as we all know. So I'm going to give you some criteria here that is important to remember. P1, priority group 1, do not pay for any medications, so all these would be 0. Also, priority groups 2 through 8 are limited to a $700 annual cap. So if they had 30-some medications and they hit that 700 pretty darn quick, that's all they'll pay for the year. But why would we want them to reach that, right? I mean, 700 is not all that bad, maybe to you or me, but somebody who's on an extremely limited income, that's a big hit potentially. And so what if they come out with those 35 drugs and 34 or maybe 30 of them they're paying for all of them and they're all tier 1, tier 2s? What you might want to do is pull up the formularies and look at, say, a Humana MAPD and say, well, if we moved all these tier 1s and 2s, you can get 30 of these meds at 0 cost for Humana Pharmacy. And now then you're only looking at maybe 3 or 4 of the brand names. And a lot of those, if they're only $33 for 90-day supplies, you could potentially get the brand names at the VA and then get the tier 1s and 2s potentially from the Medicare Advantage plan. So you can use both systems to the best of that veteran's ability to save the most money. But the VA does not talk to Medicare. So they would have to go to a civilian doctor and get those prescriptions from a civilian doctor. So just keep in mind that's a nuance that you could help somebody with in the case where they're just getting blown away with the cost of medications at the VA. You can utilize both to your advantage. So that's where an MAPD could potentially help you there, or a PDP and MA and sub situation. So what about the non-VA prescriptions? So what happens if they go to a civilian doctor with original Medicare? Well, then they'd have to pay out of pocket if they don't have a PDP or MAPD, right? So if most of their prescriptions are at the VA, you can create a way for them to get medications outside the VA with that MAPD like we talked about. But what if you put them on an MA only, because they get the majority of their prescriptions at the VA and they happen to go use that civilian MA only honor plan to go see a civilian doctor that they want to see? Let's say they just have a chest cold and they just need to go to a civilian doc real quick next to their house. It's a Friday afternoon and they just need to drop in to get something for a congestion or something like that. And it's a cheap med that they prescribe. It's a amoxicillin or something like that. So my suggestion to those folks might be to look at the cost of that medication and potentially just pay for cash and just knock it out and just get the med and go down the road. But as we know, with those honor plans, they don't have prescription drug coverage, right? So that would be an instance where they would need to pay cash or use like a discount kind of card to get that med at a lesser expensive route. That's a temporary med that's extremely cheap. But let's say they go to a cardiologist and they get prescribed a civilian cardiologist on the honor plan, and let's say they get prescribed a monstrously expensive med that doesn't have a generic attached to it, and it's something they're going to have to take long term. That would be something that they would want to talk with their VA doc about and potentially transfer those medical records to the VA to get the VA to prescribe that med at the VA. So there is a form that they can fill out that allows the civilian doctor to speak with the VA doc and transfer those records, or they can personally transfer those records from one doc to the next. They can even organize a peer-to-peer for the VA doc to talk to the civilian doc. So all of those have been made much easier to happen in the last few years. And so that can be done. But just know that a VA doctor cannot prescribe a medication that can be then, used at a local pharmacy. They would have to get that prescription at the VA. Same thing with a civilian. If a civilian doctor prescribes a medication, they cannot fill that at the VA unless the VA doctor basically rewrites that prescription after looking at the medical records for them to get that prescription there. So there is a process there involved, but use that wisely. I don't think I would transfer every medication to the VA if it's something temporary like I described in that first example. But it is good to keep both doctors in the loop. If you're going to see a VA doc, primary care, and you happen to go see that other doc for congestion, might be a good idea to call that VA primary care doctor and just keep them in the loop with what's going on with you or that veteran. So encourage that with the veterans while you're there. So emergency care at a non-VA facility. We talked about the importance of having Part B and paying for Part B. A lot of it is related to emergency care and that additional care at civilian in a civilian situation. So you notice this down here, ambulance services may not always be covered by the VA. So what happens if somebody gets in a car accident? So those folks that the veterans would talk to you and say, what do I need anything else for? As they made an appointment with you. I always think that's funny. But they make an appointment with you to talk to you about it, but then they buck the idea of having a private coverage, and they give you a little bit of a hard time about it. And they say, well, I go to the VA for everything. And we want them to. We want them to enjoy the care that makes them the most happy. But it's not a bad idea to have a backup plan, because if they get into an accident, do you think the ambulance is going to say, hey, are you a veteran, and let me drive you to the closest VA hospital facility? No, they're not going to do that. They're going to take you to the fastest trauma center they can get you to. So then the just like anything in the military, everything is very structured in in protocols. If you do not follow the protocol that the VA sets, the likelihood of them covering that emergency services dwindle down very quickly to where that veteran is going to be responsible for those civilian costs. And if they only have original Medicare, and maybe you don't even have Part B, that could ruin them financially. So again, that's why the VA recommends that they take Part B when they're eligible, because VA is not credible medical coverage. And so that's why they want them to do that. So if they have their A and B, another good idea might be, if they're super happy going to the VA, they can absolutely continue to do that. But it might be a good idea to have a backup plan of an MA honor plan just running in the background in case of emergency. Or an MAPD, whatever makes the most sense for that person. Mission Act, there is so much more to the Mission Act. I'm going to encourage y'all to go to the VA website. I'm going to give you a link to the Mission Act and read what all is in the Mission Act. This is not everything. This is just a small portion of it. It is really impressive what all they've done with that Mission Act. But for the, as it relates to this training, we're going to talk about when the VA cannot provide care within certain designated access standards, that veteran has the right to contact the mission for approval. So they can't just use this automatically. They have to get approval. Remember, I told you, tight HMO, they regulate everything you do. And so this is part of it. If you have longer than a 30-minute average drive time to your primary care, which also acts as your mental health care, and non-institutional extended care facilities, if it's longer than a 30-minute average drive time to those facilities, then or longer than a 20-day wait, then you can contact the mission, and the mission could approve for you to go see a doctor that is closer to that veteran, and they would pay them for that access. But again, it has to be approved. Same thing with a specialist. If you Google search where your closest VA hospital is, that's where your specialists are housed. So when you go into somebody's house, you might want to know that. If it's around or the area that you're working, for that day, know where that closest VA hospital is, because that's where all the specialists are. If it's longer than a 60-minute average drive time, that could be annoying. Or potentially they have longer waits for a specific specialty, longer than 28 days, or a longer drive time than 60-minute average. They can request to see a specialist out of the civilian network and get access to them that way through the approval process. So again, if they don't want to go through that approval process, I applaud the VA for coming up with a Mission Act to give access to civilian doctors, but it's still a process. So if the veteran doesn't want to have that constriction, they could have a backup plan of an MA only honor plan or an MAPD, whatever makes the most sense for them. Eligible vets are able to access urgent care facilities that are in a contracted network that the mission is currently continuing to build. So just like any network, it takes time to build it, right? So if a veteran, if the veteran looks up urgent cares in their area and there's not one contracted, the VA is urging, or the mission is urging those veterans in those areas that don't have a contracted urgent care to refer up an urgent care to them so they can contact them about adding that urgent care to their network. So some of the advantages of VA healthcare: understanding the unique considerations and circumstances for the veteran population, helps people who need help the most per financial status or disability. It is affordable care, as you found out, and they can have access to other coverage openly. So VA does not talk to the Medicare. Medicare doesn't talk to the VA. So you can use two plans to your advantage, basically. You can use the VA facilities for the advantages you want to have there, and then you can use an MA or MAPD for the advantages you want to have on that side. And so like the honor plan, like y'all know, a lot of them have big give backs and dental and vision and all these bells and whistles. They don't have to use any of the coverage, and they can just use all the bells and whistles if they want and just continue to use the VA as is. It's just a good backup plan. And then if there ever is an emergency, worst case scenario, they'll have a copay for an emergency care service. So it's pretty awesome kind of setup. What are some of the challenges of the VA? Well, we learned that not all veterans are eligible or qualified. So that's a problem. And my stepdad was one of them. So my stepdad, he served honorably, was discharged honorably. He never left the States. He served in multiple posts here in the United States, but was never injured. And a few years ago, he did not financially qualify. But then he officially retired, and I encouraged him to apply again after he retired. And then he did financially qualify. Now he does have access. So that possibility of getting into the VA does change, even if you're not injured or have a condition related to service. If your financial status kind of changes, or the rules related to where you live can give you access to the VA as well. Because sometimes that financial qualifier is a little higher if you live in a city versus like a rural area. So that threshold might be a little lower. So I encourage folks to apply and see. And then if that financial status changes or if they move, apply again. My dad was a different story. So my dad served as a crew chief on medevac. He was in Agent Orange constantly. He had conditions related to his service related to Agent Orange, and he was, even though he makes a lot of money, he was not. Financial was not a qualifier for him. He got into the VA because of condition and injury related to service. So those are two examples for you. Access to facilities, again, that could be a challenge. I told you, it's wise to always Google search. If you go into a little rural town somewhere or a city, make sure you look up and find out where that VA hospital is, or where the VA primary care doctors. Sometimes it's an official VA office. Sometimes it's a CBOC, which is basically like a sub office for rural markets. Check those out and see how close they are to the veteran that you're serving there in that community. Many physicians, they just choose private practice. So they might be a physician in the military and they retire from that and they just choose private practice just because, it's just, they just want to get away from it and just do their own thing. Now, if you live in Nashville or some of these other markets that are really kind of cool, because Vanderbilt has a lot of doctors that have a private practice and they do double time at the VA, which is really cool, because think about how easy transfer of medical documents would be, and prescription transfer is pretty easy in those cases. And then it can be difficult to have a second opinion with the VA, like I was talking about. Some of these markets, they're going to assign you a specialist, that is your specialist. And if there's no other specialist in that field in your market, it's not like you can go to the next town over. You can't do that typically without special approvals. And so if you don't like what that specialist has to say, it's nice to have a backup plan of an MA honor plan or MAPD to get that special or second opinion much more easily. So I think this is one of the last slides here on this section. Then I'll answer questions if any come up in the chat. Will Medicare Advantage change or take away VA healthcare? It will not. VA cannot bill Medicare Advantage, and it cannot bill the VA. It does not disrupt the VA coverage at all. They don't talk to each other. The VA is not credible health coverage, but it is credible drug coverage. So again, it's really important for that veteran to take their Part B when they're eligible for it, and don't only rely on the VA because it is not credible medical coverage. If they do delay Part D, as in Delta, that is okay because that's credible drug coverage if they are accepted into the VA and have that credible drug coverage. So you can have to. So why, you may ask me, I have a lot of people ask this question, well, why does the VA say this? Okay, so whenever the member goes into the VA, we always say to eliminate confusion, if they have original Medicare or a Medicare Advantage plan, don't even show those cards. Just show the military ID and that information because it's just the VA. Now, if they have a SUP, guess what the VA can do? The VA can recover some of the costs by billing a SUP. That's why they ask for private insurance provider information. That's why they ask that, is because if that retiree has a SUP, then the VA can recover some of their costs and it helps them. So if you do have a member with a SUP, encourage them to show that SUP card at the VA, because then that will help, the VA, costs and those type of things. So a little tidbit information there. So why enroll in a Medicare Advantage plan? Again, those emergency coverages, plan extras, dental, vision, all those cool things, potential savings opportunities, manage risk, all those good reasons, potentially access more providers, second opinions, more prescription formulary options, all those kind of things are good reasons why somebody might want to have a backup plan in Medicare Advantage. As we know, honor plans are have give backs in most markets. I think even in Florida, it's well over $100 a month paying down on Part B. So if they're paying Part B, it'll pay that down considerably in most markets. Here in Alabama, it's $50 give back. Dental, when we did a survey of veterans and asked what the most important thing was to them, we had an independent survey of those folks, and they said dental was number one. And so dental is wisely put onto our honor plans in a very good way. So think about those type of things, how that can help the veteran and those honor, and see if an honor plan is available in your market. Now, this is a little tidbit for y'all. What about, this is a special enrollment period, and Humana has been worked this out with CMS years ago, and the other carriers are finally catching a clue about this and asking CMS about it. So I always thought that was kind of funny. They're like, OCC. I'd talk to other carriers and they're like, what is OCC? Well, OCC is other credible drug coverage. So if you come across a member, or a prospect, I should say, that has drug coverage and they have access to the VA, guess what? They have, if they're using the VA for all their coverage and they don't really need the drug coverage on the civilian side, you can use SCP OCC and move them out of that MAPD or PDP and into an honor plan. How cool is that? So now that SCP can be used any time of the year. So if you come across a veteran that has that situation and they don't really care to use the drug side of the MAPD or PDP, well, then you can just knock that stinking thing out and grab an honor plan for that person that makes sense for you. Now, here's another spin on it. What happens if you're helping folks sign up for the VA, right? And let's say they already have MAPD or PDP. and you help them sign up for the VA and they get accepted and they qualify, now they have other credible drug coverage. Guess what? Now they can make some choices in their care further and possibly dropping the civilian PD and moving into getting everything from the VA and having an honor plan to enhance their coverage. So just a thought there. Now we're going to look at the chat. Did you see any? Let me make sure I'm not going to mess this up. Okay, control. Let me grab the chat. I don't see anything.
Can you hear me, Eric?
Yes, sir.
Okay, yeah, I do not see any questions in chat as of right now.
Awesome. Sounds good. I will hide this thing and we will move on to the next section that everybody's probably waiting for. Tricare for Life, Champ VA, Medicare and Use. So we're going to talk about that in this big scary monster here that we have. But we are going to talk about Tricare for Life, and then we'll get into Champ. So we're going to talk about Tricare first. So again, it's important with the needs analysis to ask that question, are you a veteran? And then if they say yes, follow it up with, do you have access to the VA? Do you have Tricare for Life? Do you have Champ VA? If they say, yes, I have Tricare for Life, then that's what we're going to talk about right now and what that looks like. That helps you understand by doing that needs analysis that you can explain to them how it works. So just so you know, there is Tricare Select, there's Tricare Prime. Those work more like employer group coverage. We're not going to talk about those today. But when somebody transitions to Medicare, when they get their A and B, they need to contact Tricare for Life. Once they have their A and B, their Tricare Prime or Tricare Select, if they qualify for Tricare for Life, they can be transitioned into Tricare for Life as long as they have Parts A and B. So that's where a lot of confusion comes in. You'll hear language like Tricare East, you'll hear Tricare Prime, you'll hear Tricare Select. Those are not what we're talking about today. We're talking about when somebody qualifies for Medicare and they get their Part A and B, they need to contact Tricare and see if they qualify for Tricare for Life. If they do, it is amazing because original Medicare becomes primary coverage. So that's why it's important to have Part A and B, just like a SUP, right? So we're talking about primary and secondary coverage. So you couldn't have any SUP if you didn't have Part A and B, right? That's a requirement. So again, you have to have a primary payer. Once that person has their A and B and they contact Tricare to see if they qualify, if they do and they get into Tricare for Life, Medicare becomes primary, and then Tricare for Life it acts like a SUP F with drug coverage. It is really awesome. And so anywhere that accepts Medicare, they can go to those doctors. And original Medicare and Tricare for Life coordinate benefits, so they don't even see a bill. So as long as original Medicare approves whatever care they want to get, so Medicare approved care, then Tricare for Life pays the cost share and they pay nothing, and it's all coordinated. They don't get a bill or anything. It's pretty amazing. Then when they go to get a prescription, they look up the network of pharmacies, civilian pharmacies. They look up the network of civilian pharmacies, and they go to those pharmacies using Express Scripts, who administers the drug plan for Tricare for Life. They can also order to save money. So if you run across somebody that has a lot of medications and maybe they're a little bit upset about the cost of those meds, have them contact their contact for Express Scripts to see if changing to mail order will drastically reduce the cost of those meds. It likely will. So don't automatically think MAPD, because there's some ramifications to that we're going to talk about. It is extremely important to do a thorough needs analysis when you're talking to these folks about Tricare, okay? Don't just blow these folks off. You need to do a proper needs analysis to see if they may be a good fit for anything else, because they may have specific situations to where having a private plan might be beneficial to them. Okay, a lot of people run from this, but it's very cautionary. We don't want you to run. We want you to do a proper needs analysis to see if it's a wise choice to have anything else other than Medicare. So, do Tricare beneficiaries need to enroll in A and B? We covered that. They absolutely do, because it's a primary coverage. Cautionary tale. This is what we're talking about now. Can a Tricare for Life beneficiary enroll in an MA only? Caution, yes, they can. However, things change, right? So and again, we're only talking about primary coverage. You're not going to get rid of Tricare for Life. It will not cancel, contrary to other incorrect information. It will not cancel if you put them into an MA only honor plan. Even if you put them into an MAPD, there's just things that change with it in how the billing works, and you create a network, right? So it's wise to really look at the importance and stress the importance of a network to those folks considering an honor plan in place of the Medicare, right? So it's important that they understand that it does create a network. Also, billing will not be coordinated anymore. What does that mean? That means when they go to the doctor with original Medicare, it's coordinated, meaning they don't have to do much of anything, and they're not going to get a bill as long as Medicare pays as primary. It'll just be zero. They're not going to get a bill. The likelihood of getting a bill is almost zero. So if they change to an honor plan, MA only, there also has to be a change on the way that they communicate with that doctor. When they go to that doctor, they need to hand that honor plan and remind them that the Humana honor plan is now primary. And then they need to hand the Tricare for Life billing information. It'll be on their military ID, just like any SUP, right? If a SUP is presented to a provider anywhere in the country, what do? I'm going to give you an example. Let's say you're in Alabama and somebody comes and visits from California and they have original Medicare and a Kaiser SUP. Do you think a ho-dunk town in rural Alabama is going to know how to bill Kaiser? Likely not. What do they have to do? They have to contact the information on the SUP card, right? And then ask them how to bill it, submit the billing, and follow that procedure to get their that reimbursement, right? Same thing with Tricare for Life. So if you hand them that honor plan, again, they have to be billed separately for the cost share to Tricare for Life. So the doctor needs to be instructed that the billing has changed. Bill the primary as Humana honor, and then the secondary, all cost share, gets billed to Tricare for Life. And here's the information for Wisconsin Physician Services. It's right here. And all they do is they call Wisconsin Physician Services, and Wisconsin Physician Services walks them through how to bill them. And I tell you what, those folks are phenomenal, easy to deal with. They actually even have a system that they log into, submit the bill, and they pay very quickly. They are awesome. I've heard great things from a lot of providers about them. Okay, so that is the cautionary tale. Here's another cautionary tale. What happens if you put that person into an MAPD? They will not be disenrolled from TFL. Okay, so again, that is a misconception in the insurance world, Medicare world, that they will lose Tricare for Life. They will not lose it. But again, there's billing changes, right? So on the MA side, if they go to the doctor, same rules apply. They hand the Humana card. They also hand their military ID with the Tricare information on it and request that Humana be billed as primary and all the cost share billed to Tricare for Life is secondary. But you did something. You put them on a PD, MAPD, right? What happens on the prescription side at the local pharmacy? When they go to the local pharmacy, they can no longer use their Tricare for Life prescription coverage with Express Scripts. You've just created a situation where their Express Scripts from Tricare for Life that they could have continued using with the MA only at the local pharmacy or ordering through Express Scripts mail order. If you put them on an MAPD, the PD becomes primary. So guess what happens to the drug coverage of Tricare for Life using Express Scripts? It gets put in behind the scenes. So now you've just created a coverage gap for those folks. That's why we do not advise in very many situations that you put somebody on an MAPD that has Tricare for Life, because now you've taken away their ability to use their Express Scripts at the local pharmacy or order from Express Scripts through their mail order. So if somebody comes out with that basket full of drugs, do not automatically think MAPD. Have them contact Express Scripts through Tricare and ask them about the mail order process and saving money that way, rather than automatically thinking MAPD or PEP. So here's the last cautionary. What about somebody enrolling in a PDP and a coverage gap? I mean, not a coverage. Well, it will give you a coverage gap. So, but what about a Med Sup? Well, the Med Sup is pretty much useless. They're paying for something they don't need, because Tricare for Life acts essentially as their SUP. And so basically they're paying for something that they don't need on the SUP side. So the PDP side, again, now you've created a civilian plan that they have to use at the drugstore and or through the mail order. And now you've created a coverage gap for them. And so that is a challenge. So again, our suggestion there is have them contact Express Scripts through Tricare for Life and talk about reducing those costs by ordering that stuff through the mail. So does Tricare for Life pay for copays on an MAPD? They sure do. Like we talked about with the billing side, I'm not going to reiterate this again, but just make sure that you repeat this multiple times to that prospect that they need to hand both cards, and remember to handle both cards. What happens if they get a bill? Guess what that means? And you may want to have that member, if they do decide that an MA only honor plan is a wise choice for themselves based on their own needs, well then they need to repeat it back to you. If you ask them the question, if you get a bill in the mail, what will you do? What is your course of action? Their course of action and their answer should be, I'm going to contact the provider to make sure that they send that bill to Tricare for Life. And then I'm going to call you, my agent, just to make you aware of the situation. We don't want them calling the carrier, because sometimes the carriers can get confused, because ultimately they are responsible for their copays. And that's the answer they'll get with member services out of any carrier, right? But the carrier doesn't necessarily know that they have Tricare for Life and that they have something that will pay that cost share. So it's important for you, the agent, to make sure that they fully understand that and that they are capable mentally of handling those kind of situations if a bill were to come to their house. So that's important. Can Tricare for Life beneficiaries enroll in an MAPD plan to only use additional benefits? This leads to a lot of allegations. No, you can't do that. So, and what we mean by that is we've had agents that say, hey, just enroll in this honor plan, just for the dental or whatever. Remember, this is Tricare. This is not VA. This is Tricare for Life. It has to have a primary payer. Who is the primary payer if you put them on an MA or MAPD? It is that carrier. You've now changed it from original Medicare to that carrier. So they have to use the network of that provider that you, network of that carrier, instead of just using original Medicare, right? So it's not, whenever you're talking about Tricare or even Champ VA, that's not the only use is the dental, the givebacks, and all the OTC and all the bells and whistles like it is with the VA. It is their primary medical coverage now, and they will have a network, and they can use the dental and all those things, but they have to use the entire plan for their care. Do Tricare for Life beneficiaries receive dental coverage? They can. It's the Federal Employees Dental and Vision Insurance Program, and so they can buy that. They pay a premium, and there is cost share.
So that's why a lot of times you have Tractor for Life beneficiaries say, hey, kind of interested in this honor plan because it has all this dental and the OTC and the givebacks and all that stuff and vision. So because they have to pay for it, then they have cost share, where a lot of the honor plans, it's zero cost share up to a certain dollar amount on most of those plans for dental. And then they get an allowance for vision. So that's why, that they ask about that a lot of times. Can a Tricare for Life beneficiary enroll in a Med Sup and or any other coverage? We covered that. It is literally, they're paying for something that is not in use. Because the Tricare with original Medicare, Tricare for Life literally acts like a Sup-F. So if they also bought, because some agent did not ask them the question, are you a veteran, and didn't find out that they had Tricare for Life, and then just automatically sold them a Sup and a PDP without knowing that, they didn't try and hurt that person, but they sure didn't help by not asking that question, did they? And so now they have a Sup that they've been paying for years that they didn't even need, that they basically paid for nothing because Tricare for Life was actually paying for everything. So, because again, it's coordinated with original Medicare. So the Sup is irrelevant. Again, PDP, we talked about the ramifications of a PDP. Can a veteran have Tricare for Life and VA healthcare benefits? Yes, they can, but there's a big but there. They do not want that veteran that has access to Tricare for Life, that has access to all these civilian doctors to go to the VA, unless it is for a condition or injury related to their service. Okay, so that's the only thing, because again, remember who is the primary care insurance. It is original Medicare and or a private MA plan, and the VA cannot bill those. And you certainly don't want to put somebody with Tricare for Life on a Sup. So guess what? The VA eats that cost. And so that's really expensive for them, and it adds to the cost of running the VA when they could be investing that money into something else. So unless that veteran that has Tricare for Life has a condition or injury related to service, that's the only thing they want to see them for at the VA. Here's some claim scenarios really quickly. We talked about that already. So I'm going to give you a scenario. Let's say you come across, or the member comes across a doctor that just refuses to bill Wisconsin Physician Services. Well, they can still get their money back for that cost share. They would just have to, submit the original bill along with filling out the DD 2642, and they would get a reimbursement. Okay, but to be honest with you, I'm going to just, again, I'm always real with my presentations. Is that doctor really worth going back to if they're not willing to simply file a cost share for a veteran? Doesn't even make sense. So I've had, in my 10 years with Humana, I've only seen this 2 times, maybe 3 at the most in 10 years, where a doctor refused that and then the veteran never went back to that doc. So just keep that in mind. They can decide not to bill it. That's their choice. Doesn't happen very often, but if they want to be stubborn about it, then there is recourse for that veteran to get their money back with that DD 2642 and the copy of the original bill. Just follow the instructions on that. And I will be sending that form, by the way. It is a PDF that you can edit, and I'm going to be sending that to your leadership to get out to you, the agents in the field, so you guys have that. So if that ever comes up, you have the ability to have that in a digital form and help your members out. Tricare for Life member enrolls in an MA plan, visits a network provider, and provider agrees to bill Wisconsin Physician Services, who is a third-party administrator that processes the claim as secondary coverage. Works phenomenal, right? That's ideal, but it's not guaranteed like we talked about. That's the way it should happen, and your member should be cluing them in when they change from an original Medicare to a Humana Honor Plan or other MA plan. And again, they need to show that Tricare information. If they and tell them that they need to physically bill it. And if they get a bill, question them, quiz them. If you get a bill, what are you going to do? That answer should be, I'm going to call that doctor and remind them to bill that cost share to Tricare. And then I'm going to call you, the agent, and just let you know what's going on. That's extremely important. You don't want them calling the carriers because it could lead to an allegation because something may be missed, because ultimately they are responsible for their copays. Even though there's a secondary payer, Humana doesn't know that. Any other carrier doesn't know that. So that's important to know for you. Tricare for Life member enrolls into an MA plan, visits a network provider, but does not agree. We talked about that using the DD 2614 or 2642. Sorry, I'm not sure why that was repetitive. So Tricare for Life member enrolls in an MA plan and visits out of network provider. So we do have this situation that happens. I'm going to give you two scenarios on this. Again, a PPO you can go see in or out of network, right? So honor plans, most of them across the country are PPOs. I'm going to give you my examples. If they go to a hodunk middle of nowhere provider that barely knows how to bill Medicare, let alone a private carrier in general, I tell you, and they're out of network because they only accept the original Medicare, there's some docs out there still like that, super old school, and have not accepted the Medicare Advantage world yet, and they're out of network, and they do not even know how to bill us. So what happens if they tell that Tricare for Life member, even though they have a PPO and have access to out of network, that doc can say, you know what, I'm not billing Medicare, or I'm not going to bill that carrier. So then that backs that Tricare for Life member in a corner, right? So just know that it is always more wise to make sure that they stay in network. But I am going to give you a happy story about it as well. So here in the state of Alabama, UAB is not in network for us, but they do file out of network on our PPOs. And they do file Tricare for Life separately. We do have members on our plan that go to UAB, and they properly bill Humana, and they properly bill Tricare for Life, and that member never sees a bill. So there's the worst and the best right there, okay? So just know, it is always wise, as you know, with any Medicare Advantage plan, even, especially, well, obviously HMOs, you have to stay in network regardless, but with a PPO, it's still best to stay in network because you're going to have the best member experience that way. So here's a couple scenarios of lessons learned. Member asked if she could get dental and vision without getting the rest of the coverage. That actually did lead to an allegation that was founded because the agent ended up, again, misjudged that. Again, this is Tricare for Life, so they have to have a primary coverage. So the agent ended up telling them that, oh yeah, you could use dental and vision. You don't need the plan for anything else. Well, yes, they do. They needed his primary coverage, medical coverage. And so they were wrong, and that was a founded allegation. So make sure that they know if it's Tricare for Life, that is primary coverage, and they use the entire plan. Again, VA, different, right? That's why we covered that first. Completely different. You could use either or if they have just VA coverage. But if they have Tricare for Life and you put them on an MA or MAPD, that is now primary. All right. Let's see. Member was told by agent of record that HMO plan would not affect Tricare benefits. Again, think about this one. This is a really rough one, and this is why I'm highlighting this one. If you have a veteran that goes out of network on an HMO, guess what? That's a problem, a big one. Because, again, with an HMO, if you go out of network, there is no coverage as primary, right? So guess what? Tricare for Life won't work either. So now the member's on the hook for the entire bill. Don't do that. When you're looking at Tricare for Life, folks, I'm not at all a fan of even considering an HMO personally. You may have somebody that is like super in tune with their plans and they're checking their providers constantly and all that kind of stuff, and it's a perfect scenario, but we all know Medicare members are not perfect scenarios. So I would err on the side of caution and maybe just look at PPOs for somebody that has Tricare or CHAMP. Health and drug coverage for eligible spouses. Okay, that's CHAMP VA. Are there any questions related to Tricare for Life before we move on to CHAMP?
I do not see anything in chat, Eric.
Fantastic. Well, you guys are good. All right. Oh, let me move that. Okay, there we go. So CHAMP VA, again, it's just for a different group of folks. So if you have somebody with CHAMP VA, it's health and drug coverage for eligible spouses and dependents of veterans. So again, I'm going to explain the difference of somebody that's not Medicare aged, right? So if I'm going to give you the scenarios first, and then I'm going to explain how CHAMP VA works prior to Medicare eligibility and then post Medicare eligibility. So it is health and drug coverage for spouses or dependents if the veteran falls into any one of these categories. Let's say the veteran is rated permanently and totally disabled due to a service-connected disability, so 100%. So maybe they were rated permanently and totally disabled due to a service-connected condition at the time of death. So maybe they died of a condition related to their service. So think Agent Orange here. So somebody got a rare form of cancer based off of Agent Orange, and they died because of that. Maybe when you did your needs analysis and you uncovered that somebody's spouse was a veteran and they served in country in Vietnam, that's a good indicator that they were likely exposed to Agent Orange. And then you find out that they end up passing away, that they passed away of some type of cancer or heart disease or a variety. There's a massive list that Agent Orange was the cause of death. It was a condition, it created a condition that caused death. The person in front of you may not have CHAMP VA yet, but because you asked the question and you dug down in the needs analysis, you just found out that they may qualify for CHAMP. Your next recourse is to call a veteran service officer. And so we're going to talk more about that in a little bit. This happens all the time. We run across spouses that don't even realize that they qualify for CHAMP VA. It's sad, actually. And then another qualifier is they died of a service-connected disability. So again, condition, disability, they died from that, or they died on active duty and the dependents are not eligible for DoD Tricare benefits. So, wow, there's a lot of various different qualifiers there. A spouse or dependent who is eligible for Tricare is not eligible for CHAMP VA. So, if they are eligible for Tricare, they can't also get CHAMP. Tricare is actually a little slightly stronger, has slightly more benefits there, but we'll talk about that. So, if they have CHAMP VA, I'm gonna talk about two different things. So if they are not Medicare eligible, it's still called CHAMP VA. It's not like, it can be easily confused. It works almost like employer coverage, and that those people, spouses and dependents, before they're eligible for Medicare, they can go to the VA. Okay, so this is something a little different than what you're used to hearing. They can go to the VA for their care. But once they become Medicare eligible, they can no longer go to the VA. Medicare Part A and B become primary, and CHAMP VA becomes secondary coverage like a SUP F with prescription drug coverage, right? So that's what happens when they obtain Medicare. So once they become Medicare eligible, they do need to contact CHAMP VA, make them aware of when the Part A and B start date is, and then they'll be transitioned over to CHAMP VA as it works like a SUP, right? So they must enroll in Part A and B. CHAMP VA becomes secondary. Remember, they used to be able to go to the VA. They can no longer go there. Then what happens is original Medicare and CHAMP VA coordinate benefits, and the member can go to anybody that accepts Medicare, any doctor that accepts Medicare, and it's coordinated billing, and so they're not going to get a bill. So that's fantastic there. It's easy. When they go to get their prescription, remember I said the prescriptions are built in, they can go directly to any civilian pharmacy that is in the network. So there's a network that's provided, just like Tricare for Life. There's a network associated with it. And they also have access, and it's not administered by Express Scripts. It's different, okay? They also use meds by mail. That's all controlled by the VA. So meds by mail is the mail order. It is not Express Scripts for Champ VA. Now, there is copays for the meds, most meds, at the civilian pharmacies, right? But so if they're complaining about higher costs of their meds at the local pharmacy, simply have them contact Champ VA and talk about the meds by mail program, and that will likely save them a lot of money by going through the mail. Can a Champ VA beneficiary enroll in an MAPD or PD plan? They sure can. But let me tell you, so again, same thing as we discussed before, the MAPD becomes MA or MAPD becomes primary on the medical side. So again, when they ask their doctor to bill, they would need to tell the doctor to no longer turn it into Medicare. And they need to turn it into the carrier, and then they need to bill Champ VA separately for the cost share. So the same exact scenario happens. If the member gets a bill, you need to make sure they know how to handle that. They need to be prompted to answer your quiz at the end and answer correctly, that they're going to, if they get a bill, that they're not going to call the carriers, they're going to actually call the doctor, remind them to bill Champ VA, and so they won't have that cost share. So just another note on that. I will tell you this is a big difference between Tricare for Life and Champ as it relates to the drug coverage. So again, if you put somebody or find somebody that has been put on an MAPD or PDP, again, instead of using Champ VA at the local pharmacy, they're having to use that civilian plan. What does that mean? That means somebody gave them a coverage gap with that civilian plan. With Champ VA or Tricare benefits on the prescription side, there is no gap. So now somebody put them on a private plan, and now they have a coverage gap. But here's the secondary problem that is affected with Champ VA specifically. They will have a disruption to meds by mail. It cancels meds by mail. Now, it doesn't mean it doesn't cancel Champ VA, but it will cancel their meds by mail, and it is a royal pain to get it back. So if you find somebody that's on Champ VA and has civilian PDP or MAPD that wants to go to use that SCP-OCC and go back to an honor plan, and they want to use meds by mail, they have to reapply for meds by mail with the VA, and it can take up to 3 months to get it reactivated. So it'll reactivate. It just takes time. Now they can use their Champ VA in the interim at the local pharmacy that is in their Champ VA provider guide there, or for pharmacies. So next thing is we're going to talk about MA only. So MA only it can be a solid choice for them, but again, you just need to remind them about the billing challenges that may present themselves. They have to make sure that you reiterate to stay in network for the best possible experience with the plan, and remind them again to not only show them the MA only card to bill and tell the doctor to bill as primary, but then also show the Champ VA and tell them that they have to physically bill Champ for the cost share. And if they get a bill, don't forget, quiz them how they're going to handle it. They're going to call the provider and remind them to bill Champ for that cost share and call you to make you aware of the situation. Do not call the carrier for that. All right. So does Champ VA pay for copays on an MAPD? We just covered that. They sure do. It's not perfect. They have to bill it separately. But yes. Can Champ VA enroll in a med sup? Same thing as Tricare for Life. They can, but they'll just be paying for absolutely nothing. So again, if they have original Medicare and a SUP, it's automatic. The billing is automatic. And so literally the SUP is just sitting there and they're paying a monthly fee for completely unnecessary reasons. So again, did the original agent do something wrong, or malicious, I should say? Did they do something malicious? No, but did they do something wrong? In my opinion, yes. They did not do a complete needs analysis to find out if they had if they were a veteran or veteran spouse, and then if they had CHAMP, Tricare, or VA. They didn't do that job. They sold them a SUP on top of a plan that acts like a SUP. And literally, those people have been charged thousands of dollars over years for nothing. So don't do that. And if you find it and they're on a PDP, make sure that you talk to them about using that SCP-OCC and potentially going to the honor plan. So can CHAMP be VA beneficiary enroll in an MA or MAPD plan to only use ancillary benefits like dental give back, OTC? Again, no, not with CHAMP and not with Tricare. You have to use the entire plan and use that network. VA is completely different. You could use them completely separately from each other, and just use the ancillary benefits if they have just VA benefits. But if they have CHAMP or Tricare, that plan becomes primary, and so you have to use the entire plan to your advantage. Do CHAMP beneficiaries receive dental coverage? Again, they can through the VA DIP. So again, they would have to pay a premium, and then they would have to pay cost share for dental and vision. That's why they look to plans like the honor plan. Do Medicare enrollment periods apply to CHAMP VA beneficiaries? Yes, they absolutely do. How are claims filed with CHAMP VA? We talked about that. They need to file the claims individually to the carrier and then to CHAMP VA. That's what the provider needs to do to get reimbursed. A couple of scenarios. If the doctor does not agree to bill CHAMP VA for the cost share, are they really worth going to? That'd be my first question. Second question is, can that member be reimbursed? They can. There's a form for that, and I'm going to send it to your leadership to get out to you. CHAMP member enrolls in an MA plan and visits an out-of-network provider. CHAMP is a little bit more fickle on that. Full reimbursement is not guaranteed. I haven't seen them deny it, but they're pretty adamant in their handbook that enough to scare me into saying just stay in network and avoid any kind of challenges. Any questions on CHAMP? And then we're going to finish up with just a couple of slides, and that will be that.
See nothing in chat, Eric. We're still looking good.
I must have bored everybody to sleep. We're going to talk now about capturing veteran status. In eHub, it is required. And if you get to the application portion and you're asking what their veteran status is, you did not listen to anything I said here today. Make sure that you ask that question during the needs analysis and get all that information up front so you can properly fit a plan to that person's needs. And then you would know answer this question. That's veteran spouse, veteran referral, none of the above. Paper app, it is in there. So are they a veteran? Yes. And then you just hit the bubble for what type of veteran they are. That is not required, but again, please answer that. I mean, it's a bubble question. It's important, and we'll tell you why here in a second. And then on FastApp, it's not required, but again, please answer that question. It's beneficial to you and the member, most importantly, and I'll tell you why. So, we talked about the needs analysis, all that kind of stuff, but you see this referral opportunities and future marketing opportunities. So if you sell them a Humana plan and you mark them that they're a veteran on their application, you'll be able to pull that data in a field. So if you go to your Advantage workbench over on the right-hand side while you manage your book of business, you click on it, you can export your entire book, and it has all the person's information. It will initially show up with limited information, but you can literally just click a little checkbox that allows you to download all their information, including their veteran status. So then if you're, get to know Excel, because you can actually filter for all your veterans. And then you know what? You can call them on Veterans Day. You can call them, invite them to special events that you're doing for veterans, those type of things, and actually acknowledge them as a veteran. And that goes a long way with them. Secondary to that, how does it help the member on our side? When that veteran calls in, if you did your job and you marked them that they're a veteran and they happen to call our member services, it'll pop up on the member services screen and tell us, or the member services folks, that they're a veteran, so they can actually acknowledge that they're a veteran, and do a good job of that. So definitely do that. It's important for that acknowledgement. Here's some of those online resources that we talked about in the past. Make sure you check those out. We are going to send you an FAQ to your leadership for you to check out. Also, veteran materials. If you want to get into a VA, Legion, any of that kind of stuff, and you're not a member, I'm going to give you a couple of little tidbits of information. If you step into that VA, VFW or AMVETS or Legion or whoever that is, and you just drop off a bunch of cards or a bunch of these, educational pieces, they're likely just going to get tossed. Okay. So it's important to get to know the leadership there and to let them know that you just want to be a resource. Ask them if you could put that stuff there. And you can customize this stuff to have your name and information on it. Make sure it's not salesy. Make sure it's educational. Make sure you are plugged in with that particular post. And if you're not a veteran yourself, but you have maybe your dad or your child or a grandfather or something was a veteran, did you know that you can actually join an AMVETS, Legion, a VFW as family of veterans and go to those posts on a regular basis as a member? You can do that. So talk to the post commander, ask them about that program. If you've got a veteran that is direct relationship to you, you can pop their information into there and become a member of that post. So that's a really cool thing. We have all kind of marketing things for social media, which is becoming really big. I don't know if y'all knew this, just quick tidbit information. If numbers may not be exactly correct, but from my last recollection, 74% of seniors that are Medicare eligible are on Facebook, and over 80% are on YouTube. Might be wise to beef up your social media game. So if you're not familiar with how that works, make sure you check with your upline there. It's really important. Direct mail flyers ads, MAS does an amazing job with that. Make sure you check with those folks. Grassroots events, community events, hook up with us, and we'll work out with MAS too to combine efforts on some of your grassroots events. With that, I would just have you a couple of reminders. Reach rewards are extremely important for you to earn points towards various different opportunities and credits with Humana, but then also our MCA surveys, super important, okay? And the reason why it's important, our MCA surveys, everybody's like, well, the $50, the $50. That's not what it's about. It does help you, especially if you have like 100 apps, it's $5,000. It's a pretty good deal, but it's not about that. What that's about is how many veterans do you come across? How many regular folks do you come across that have food insecurities or have chronic illnesses? And you didn't uncover that. But guess what the survey does? It uncovers that. And it puts them in direct contact with, from day one on the Humana plan. When their plan goes effective, they will be assigned somebody to call them and contact them to help manage their care better, to help solve the food insecurity issues. And I'm going to tell you, talk about a retention tool. We do human care. It's not just a gimmick. That's what we do. And our clinical care is, I'd put it up against anybody. It is outstanding. And that MCA is the direct key that you have, and you have the ability to do, is to connect our clinical team with your member to make sure that they're cared for in the best possible way, and that's what we do at Humana. So thank you for allowing me into this and doing this presentation for you, and I'll be more than happy to help you in the future. Feel free to text me, call me, email me, and I'll be glad to guide you. Thank you.
Eric, thank you so much. You were very informative today. We really appreciate you coming in and sharing this information with us. Everyone, if you have any questions, you would like to learn some more, get a copy of this presentation, give us a call. Our number here is listed on the screen, 1-800-480-9857. And again, thank you all for attending today, and I hope you all have a great rest of your day. Bye-bye.